To begin to chip at it is to discuss what denial looks like, and it looks different for everybody. Just finding out where that person feels like their life is unmanageable for one. If we can pinpoint that, then we can start to chip away at what kind of behaviors are you using to deal with the fact that your life is unmanageable. Once you come into the awareness that my life is unmanageable, then it's like, okay, are you using minimization to make yourself feel better, to continue on with the same negative patterns and behaviors, or using justification? And so we see a couple of different things like that going on, but that's how we normally chip away at it, is first figure out where in their life is unmanageable. There was a gentleman that I had on my caseload where he was in just total denial. He had gotten into an injury at work, and he he was prescribed medication, opiates, and he began to use those. His denial was in a couple of different areas of his life. One in particular was he felt like he wasn't an addict because he was taking care of his responsibilities at his house. He felt like, I'm paying the bills, I still have my car, I'm not stealing anything, so I don't know what the big problem is if I'm just using extra money in order to use and get high. He didn't feel like he was as bad as some of the other individuals that were in rehab. What he had told me was that he would not have been addicted to the opiates if his doctor would have never prescribed them to him. So I explored that with him a little bit, and I said, okay, well, how are you using the opiates? And he said, well, I started off, orally taking the opiates, the pills, and then I recently, in the past 6 months, have been snorting them. Then I asked him, did your doctor recommend that you crush and snort your opiates in order to get high? And of course his answer was no. And so right there we were able to start to deal with the fact of that there was some form of denial there that needed to be explored, because he was minimizing, for one, his drug use compared to other people that were using IV, heroin, opiates. It's the same thing, it's just different forms of it. And so he minimized that, but then the other part was that he justified his behaviors as an addict because he blamed it on the doctor. As I was talking about avoiding the pitfalls of denial, we talked about, what denial looks like. And of course, it's still a trigger word even for clients that are in treatment. And so there's like, oh, I'm not in denial, I'm not in denial. So we begin to talk about it, and I asked for some examples, and this individual had raised his hand, and he keeps on going to his sister because he wants to know, how his girlfriend is doing now that he's in treatment, how she adjusting with me being gone, and I'm really not in that bad of shape. I don't want her to think that I'm like really bad. I just made some mistakes and things got out of control just for a moment. And so it was a lot of minimization, but then he also was justifying his use also. And so I just continued to let him kind of talk and express himself. And one of the biggest things that he was in denial about was the fact of that his girlfriend had moved on. He had a feeling about it, and he was talking to his sister and trying to get the answers, and then he started to try to get the answers out of me, and he said, man, what do you think? Do you think that she's, that she's with someone? You think that she's mad, it's over or whatever? And I said, I looked at him square in the eyes, and I said, you have the answers. You already know the answer. I don't have the answers, you know the answer. And right then and there, it was like instant. He just sat back in the seat. And of course, the first emotion that he showed was disappointment. The second emotion was anger, which is normal. But that's the thing about denial, is that we have the answers. It's just that we don't really want, we don't want to turn the light on in that dark room. Since that day, he's come around, he's made progress. He's more focused on his recovery, which is awesome. He's focused on being a better father and being a better son to his mother, and not focused on being this boyfriend and worrying about his past mistakes. That's something that he can deal with once he's out of treatment. And the other part is that he's supported by his therapist. So I'm able to work with these clients, get them to a certain place, but then also I allow the therapist to do their job and support the client and to really dive even deeper into the denial process.